I got my Bachelor of Science degree in biology at Hofstra University and also a minor in chemistry. I was very attracted to the Master of Public Health because I love to be out in the community helping people, and I felt that I could make a big impact dealing with populations rather than individuals. I loved the Hofstra MPH program. I was cultivating a relationship with Dr. Kariakou, who was the program director. I knew that a public health program was in the works. Once it was confirmed, I was sold. I knew I had to be here. I knew her. I knew what the program stood for, and it was someplace that I really wanted to be. I am a part of the Society of Public Health Advocates. I was the program coordinator for 2 terms in a row. I was also a part of National Public Health Week. We did a lot of events on campus. We did a really big services fair at Nassau University Medical Center, and we're always looking for different ways to connect with the community so that we can really go out there and let them know about us. We are a fairly new program, but I really feel like we are starting to stake our claim in the community and let them know that we are here and that we care and that we're here to advocate for them. I absolutely love the position as a grad assistant in the Health Professions Department. It has really helped me to refine my skills. I am now meeting a lot of public health professionals. I have the opportunity to network. I've been going on a lot of meetings. I've been doing a lot of key stakeholder interviews. I've been a part of bringing an interdisciplinary public health clinic here on campus. I've been working very closely with the faculty. I've built new relationships, all because of my position here as a grad assistant in the Health Professions Department. I completed my internship at We Act for Environmental Justice, also known as West Harlem Environmental Action, Inc. And We Act for Environmental Justice is a Northern Manhattan community-based organization who really advocates for people of low income and/or color and are really struggling to understand environmental justice issues and how it affects them. At We Act, I learned so much. I've been more so on the academic side of public health, and now I was able to be on the community-based organization side just to see how that organization runs and how they're really out in the community doing a lot of advocacy. So it's something that I was really attracted to, and I think that it was something that I needed to cultivate as a public health professional. So my Intro to Public Health class really introduced me to a survey of public health issues, critical public health issues, and that's when I really understood the issue of health disparities and how I can myself build health equity. Also, my environmental justice, my environmental health course introduced me to the topic of environmental justice, and is why I went on to pursue my internship at We Act for Environmental Justice. So just learning a lot of those issues helped me to really start to develop a passion in minimizing health disparities and building health equity and advocating for people that, you know, normally don't have a voice. So I'm out there in the community, I'm listening to what it is that they have to say, and I'm bringing it back on a research perspective. I was able to create Hofstra University's first annual Health Equity Symposium. It was something that I was super excited about because I was able to mobilize a vision and put my passion into practice. It was something that, you know, I had in my brain. I'm like, wow, we really don't talk about this on Long Island. I really haven't heard a lot about it in my classes. So I wanted to put out an event that, you know, students, community professionals, and faculty can learn a lot about the issues and what we can do collectively as a community to build health equity. So because of my public health coursework and my internship, I was able to highlight 3 issues: nutritional disparities, suburban health disparities, and environmental health disparities, and have a panel of presenters that talked about these issues. And then I aligned the community with professionals that they can be introduced to so that they can learn how to build health equity in their fields as well. The Margaret E. Mahoney Fellowship is administered by the New York Academy of Medicine, and I'm going to be doing this fellowship all throughout the summer, and I'll be expanding upon the research that I'm doing now for my culminating experience, which is basically examining the impact of food insecurity on mental health among suburban food pantry users. I've had a great experience just being out and, you know, collecting data from different food pantries along Long Island and learning about what the major issues and barriers are for these people to become food secure and the issues that they're dealing with. My fellowship at the New York Academy of Medicine will help me to expand upon these and figure out a more comprehensive way that we can deliver services for these food insecure people in Nassau County.